Hi everybody. We're here today to talk about COVID-19 as it has affected a lot of people and businesses, including ours. We currently do not have a vaccine, so the best thing we can do right now is to follow the current guidance to do our best to stay healthy. Here are some of the ways that we can accomplish this. Let's start with the daily health screen. These are questions that we ask ourselves every time we enter a Foldcraft business or office. Have we had any of the following symptoms since the last day of work or the last time we were here? A fever of over 100 degrees, chills, a new cough, shortness of breath, a new sore throat, new muscle aches, new loss of smell or taste. If you answer yes to any of these questions, please do not enter. Employees, contact your leads or supervisors, and visitors, contact the person that you had the appointment with. Upon arrival to a Foldcraft building, please put on your mask as required by Emergency Executive Order 2081. There are a few circumstances where your mask may be removed inside the building. If you are eating or drinking and maintain the 6-foot social distancing guideline, you are alone in an office, you are in a cubicle with walls higher than your face level. However, you need to be prepared to put your mask back on if someone arrives and you are no longer alone. While communicating with someone with a hearing impairment, or if you're asked to remove your mask to verify your identity for lawful purposes. There are a few key things to remember when wearing a mask. Wash your hands before and after. Make sure the top of the mask is over your nose and the bottom is under your chin. Try not to touch your mask while you're wearing it. Remember, the idea is to keep the germs away from your nose and your mouth. If wearing a disposable mask, change it out, throw the old one away. If you're wearing a cloth mask, wash it on a regular basis. Cough and sneeze etiquette is a good reminder any time of the year. If you need to cough and you are not wearing a mask, please use a tissue to cover your nose and mouth or use the bend of your arm, not your hands. Avoid touching your face and wash your hands as soon as possible. If you are wearing a mask and you need to cough or sneeze and you need to replace your mask, we do have disposable masks available for you. Have I mentioned to wash your hands yet today? Current guidance is for 20 seconds several times a day. Wet your hands with warm water. Apply enough soap to cover all surfaces. Rub hands palm to palm. Rub palm to back of hands with fingers interlaced. Rub palm to palm with fingers interlaced. Curl your fingers to rub your fingernails against your palms. Grab each thumb and rotate back and forth. Rub fingertips up and down against your palms. Rinse your hands with water. Dry hands with a clean towel. Use that towel to turn off the water. You've got clean hands. At this time, we have made many changes to accommodate social distancing. Those who can work from home have been asked to do so. Workers have been scheduled with staggered start times. Please remember to stand 6 feet apart. X marks the spot. When punching in and out, please remember to use hand sanitizer before and after using the time clock. Workstations have been rearranged to keep members 6 feet apart. Visitors have been limited to access in the buildings. Some of our conference rooms have been converted into break rooms to accommodate more members at break and lunch times. Signs have been added to rooms to note maximum capacity. Tables have been marked and chairs have been removed. Please do not move tables and chairs from their designated spots. Meetings will be held virtually if possible, and conference rooms have also been marked with maximum capacity signs. You've done everything you know to do to stay safe and healthy, but you are sick with COVID symptoms. Remember, that's fever, cough, shortness of breath, chills, headache, muscle pain, sore throat, or loss of taste or smell, but have not been tested for COVID-19, or you are sick and your doctor or local clinic have told you that you have COVID-19 based on a lab test or symptoms. Stay at home and separate yourself from others in your household. Do not share anything like utensils or phones. Stay at home until all 3 of these things are true. Your symptoms like cough or shortness of breath have improved. It's been at least 10 days since your symptoms started, and you've had 24 hours with no fever without fever-reducing medicine. Stay home for the amount of time that is the longest. For example, your symptoms start on a Wednesday, your temperature goes down without fever-reducing medicine on the following Sunday. After 24 hours of no fever, you could return to work on Tuesday. In this example, you've stayed home a total of 13 days. Another example would be that your symptoms start on Monday, your temperature goes down without fever-reducing medication on Thursday. After 24 hours of no fever, you've stayed at home for 6 days. But since the minimum number of days you need to stay home is 10 days, you would be able to return to work on Thursday. In conclusion, the best we can do is to try to stay healthy. The Foldcraft Pandemic Preparedness Plan and current information about COVID-19 are posted at both the Kenyon facility and the sales office in Apple Valley. As updates are available, this information will be updated as well. Thanks for participating. If you have any questions, please feel free to ask your lead or supervisor. Have a great day and stay healthy.